Dr. Gurudeva. And I see a lot of my patients. It may be a welcome sign anyway. And students and my colleagues. First of all, I thank the office bearers, including Dr. Ram Rao, for inviting me for the 38th time. I think I started giving this lecture once a year during the Maiya's time from 1975 when I landed in Bangalore from Hubli. So since then you can see almost 37 subjects I have covered. I don't think there is any subject which I have not covered. So there was a problem when Dr. Amro asked me to speak. What subject should I talk? Then I thought I will have a talk on health illiteracy on behalf of the students, on behalf of patients as well as doctors. So illiteracy doesn't mean only for the patient. It's also sometimes it is with doctors. These are all experiences I have over the years. When my dear patients ask me about 100 questions and it will show their ignorance, misunderstanding and sometimes wrong emphasis on so many things. So, the topic today is nothing but questions which are asked by my patients and what answer I give. That's all the topic. So it will involve many systems, many diseases, but I will only confine to 4 or 5, otherwise it will be a long talk. Now, why this illiteracy occurs? This is due to poor health information which the patient gets. That may be due to non-professional information by public, media and facts. Public will give, they are not professionals, they will give certain information which may not be very relevant. If they see a diabetic patient, they may say, don't eat sugar, but eat jaggery, it's okay. So this sort of information, without any scientific basis, may cause illiteracy with the patients. And also it is due to misinterpretation of information. Nowadays you see in the newspapers, sometimes televisions, telemedicine and internet browsing which has become a habit. Now I see my patient come with a record or print out of the internet, I am always afraid. They will know more causes of headache than I would have known. But the only thing is, they have the knowledge but have the wisdom to select which is the cause of headache. That is the only difference. So reading internet, browsing, telemedicine sometimes unnecessarily trouble the patient. Because if he has a headache, he will think of brain tumor, he will not think of it's a fever. So naturally, he will have more problems. That is called illiteracy. And there is, of course, a poor communication by the doctor. Many a time doctors will not be able to explain in the language which patients understand. Because sometimes you say, oh, you go to a nephrology specialist, he doesn't know what is nephrology. You say, go to a kidney specialist, okay. So if the doctors use technical terms, then it becomes difficult. So even prescribing sometimes, you see, illegible prescription is the birthright of the doctor. So that nobody else will know. So when you prescribe like that, a tablet which has to be taken by the per rectum from behind will be swallowed sometimes. You see sometimes the tablet is prescribed, it has to be pushed through the anus, they will take by mouth. So these things do happen if you do not prescribe things properly. If you say TID, they do not know 3 times a day, DID twice a day. So doctor has to explain it properly. So poor communication skills by doctor. That is why nowadays in the postgraduate selections, communication skill of the doctor is always judged. How you communicate to a patient, a dying patient, to the relatives. The patient is dying, how you talk to the relations. These are things which are very important and probably which will prevent many sort of assaults or the throwing stones in the nursing homes, and all those things could be prevented by a proper communications. Now, I will give few examples. As I told you, what the patient comes with chest pain. So patient thinks chest pain means heart pain. Chest pain is different from the pain due to heart disease. Both are different. For a patient, both are same. So, for the cardiac causes, it could be an angina or unstable angina, myocardial infarction. That is the cardiac. But many a time, chest pain is not cardiac pain. It is pain due to various organs involved in the chest. That is, could be skin, could be bone, could be lung, could be pleura, except the heart. Other things could be the pain. So, if you see 10 cases, 9 cases would have this chest pain due to other than cardiac causes. Other than cardiac causes. Other than cardiac causes. So, the misconception sometimes is, so when you come with the chest pain, if it is over the heart is somewhere here, precordial. If the pain is here, they think heart. The thing is, the chest pain does not occur over the heart. It is away from the heart. This is a misconception. Second point you find, if the ECG is normal, they think chest pain is not cardiac. That is also wrong. Many a time, cardiac chest pain is not revealed by ECG. A normal ECG does not rule out a cardiac pain. Cardiac pain, you have to take the history, the type of pain, etc. You have to take, that will give you an idea. ECG may be normal. Normally, if it is angina needle, 25% of cases it could be abnormal. 75% may not show. If it is a heart attack, it is only in 50 to 75% of the cases heart attack is revealed. Sometimes you have a chest pain, you go to a doctor, history is typical, but he does an ECG, ECG is normal. Many times this happens. Oh, ECG is normal, you are all right. But by the time pain continues and he comes to me, I took an ECG, it shows an infarction. That means multiple ECGs may be necessary to diagnose a heart attack. So what the message is, ECG is not 100% correct. Second, all chest pains are not cardiac pain. Third, even in a cardiac pain, ECG may be positive in only 75% of cases. This is the point I would like to rule out, mention. Now, next question, patient asked me, sir, is it necessary to have angiography? No, it must be said, the angiography is the only which delineates the vessels of the coronary arteries. Those arteries are blocked or not blocked or narrowed, it will tell you. It is not necessary to have angiography in all cases. So low risk cases where the patient is quite stable, walking, gets some pain, it is not necessary to have an angiography. We do what is called as a stress test. If it is positive, probably we will go. Or the patient with the high risk cases, then I think we go. That is, when you give medicine, patient continues to have angina, chest pain, then it is an indication for angiography. Or when the heart fails, not able to function properly, that is an indication for angiography. Angiography will depict all the vessels and it will also show is there any block in these vessels. So, block may be there, still there may not be pain. All this enigma is there. So, it is not necessary to have angiography in every case of chest pain or heart pain, a pain in the heart. Now, we have patients sometimes walking into the hospital. It was okay, you are talking, sir, I have got some pain. Then you take him to ECG room, take an ECG, and the patient dies suddenly when ECG is being taken. This will be a source of trouble for the hospital and the doctor. Now, what is the patient's relative say? Sir, 1 second before 1 minute is walking, so talking. And how is it this can happen? The doctor must have done something. So you will find assault on the doctor, assault on the hospital. This is a common thing we say. Because people do not know, even a minute before, a heart patient can talk properly. A second is enough for cardiac arrest. This is not understood. So this is the cause of, this is illiteracy. This is the cause of many trouble we face. And you see, in these cases, coronary heart attack means the artery gets narrowed and there will be a clot here. Then heart area of the heart gets damaged, which can be made out by the coronary angiogram. You can see this is the vessel, it is narrowed here. So that is the cause of the heart attack. Now this heart attack can come suddenly, patient may be perfectly talking, and in sleep also people die. And if this is not known to the people, and the doctor at the hospital is in great trouble. Then you have got patients with cardiac arrest. That's what happens. Suddenly, when you have a heart attack, within half an hour or so, suddenly it could be irregularly beating and suddenly it can stop. That is called as cardiac arrest. And everywhere we teach public how cardiac arrest should be managed. You know, you have to push the heart chest up and down like that about 50-60 times, and then if there is oxygen you can do that, otherwise mouth to mouth breathing they will say. I think this has been to be practiced by everyone, because this is the, when you do certain things immediately, patient can recover. Sometimes a good thrash over the chest can recover. It is like a, see actually what happens, the heart beats irregularly like this at that time, and if you put a good thrash, sometimes it becomes normal. It is like an electricity problem. So this is called as cardiac massage. Now many a time your bones get broken. That's okay, that is secondary point. A patient should live even if it is broken. So that is the important thing. I have a very peculiar advance because of the illiteracy. Now in Hubli, I was making a round on the other side, and this side when a cardiac patient suddenly got arrested. They just called me. I rushed and did this cardiac massage. They are from the village. The mother is old and is a village lady, and she saw I am doing this cardiac massage. The second son who came to, luckily I know him anyway, so came to the hospital. So what happened? He told doctor, that is what happens. An assault on the patient. This is actually what happened. Because such a ignorance may not be there, but in village you don't know. Because when we are doing that, people don't know what we are doing. So she said, so this is a illiteracy. This has to be understood, and cardiac massage has to be known for most of the people. And the next question patients ask me, is it bypass operation or stenting? Does it cure the disease? That's what they will ask. Does it cure the disease? Remember, these are not the one which cures the disease. And does it prolong life? Yes, sometimes. Most importantly, these operations are done, or stent is put. This is the stent. They put in the vessel inside the, see, this is the clot, the narrow vessel. To bypass means you take another vessel from the leg or someplace and connect. If this is the block, connect from here to here. That's the bypass. Just like NSTT bypass, you see. The congestion is there, they do that. So that is bypass. And if this is the only vessel, they can put a stent inside, and that will blood will flow through this. So stenting and CABG. People sometimes think it's a cure of the disease. It is never a cure. It is only you are bypassing so that blood supply is maintained to the heart. Now, then if it is not a cure, what is it then? It will relieve all symptoms, chest pain, everything will be relieved. So symptomatically patient will be better. That's all you expect. But it can prolong life if it is done on a main vessel. Sometimes it can prolong his life. But again, it is not a cure. And so why? You find those who had a bypass, first year 15% will, that bypass gets again occluded. After 5 years, 40%, 10 years, 50% they get occluded. That is process of occlusion, process of narrowing, like cholesterol deposition, etc. Cholesterol, fat deposition and narrowing and clot formation. This process will go on in the patient unless they do a preventive measure. What is it? Low fat diet, exercise and taking certain drugs which are important so that can cure the disease, that can limit everything. If you do that, probably all this will not occur. So, CABG, that is bypass surgery and stenting are not the cure, but definitely symptomatically they are better. Definitely you can use them when drugs do not act. Definitely in certain circumstances it can prolong life. So this is the illiteracy that people think is a cure. So that is not so. Now we will leave this coronary artery disease. We go to hypertension. Now BP. What are the things people think? Sir, they come and check, I see the BP set. Sir, I am perfectly normal, healthy person. Until my doctor checked my BP. So the doctor is responsible for BP. Sometimes he has white coat hypertension. He comes to doctor with lot of fear and then BP can go up. It is true. But he is going to say, I am perfectly normal. Only I have taken some more salt 2 to 3 days ago. So if you have taken some more salt 2 to 3 days ago, it will not increase your BP. If you are taking over the months, weeks, then it is possible. So he said, yesterday I went to a feast, he had some more salt in the dish, etc. That is the cause of BP. That is wrong. Number. Then, of course, BP varies. Different people, different instruments, and the way you take, time you take, it varies. That is accepted. But it must vary within the normal limits. Within the limits it should vary. So, this conception is, if you take few salt, more salt 1 or 2 days before, you don't have the BP. And another point you have to remember is 50% of this patient need not have any symptoms. It is not necessary to have symptoms. It is called as law of 50%. Sir, I am healthy, no symptoms, no BP for me. But 50% are asymptomatic. One day you will land with a cerebral hemorrhage and stroke, etc. Then I have got patients at 200, 130 without any symptoms, but he will land up with a stroke. So 50% are silent, of which what are we doing? 50% are get treated. Otherwise they are not ready to accept they have got a blood pressure. Of which 50% treated patients receive inadequate treatment. So ultimately you find 10 to 12%, 10 to 12% get proper treatment. That is all over the world, including the rest. So because of this law of 50%, now of course America has improved this 50% that they take drugs properly. Now, next question patient will ask, sir, how did I get BP? That nobody in the family has got it. I don't have any disease. But you must know there is what is called as a secondary hypertension, which is due to kidney disease, sometimes endocrine hormonal, sometimes drugs. All this can produce blood pressure. That you have to check. But this forms only about 10% of the cause BP. But most common cause of BP is without a cause. Number of people have got BP, there is no particular cause, but number of factors are there. Heredity, tobacco, alcohol abuse, increased salt intake and obesity. All this put together will produce hypertension, essential or primary hypertension. So that is the second question patient is going to ask. Then, how do I measure? Now everybody who has come from America will carry this electronic BP apparatus. But you know, it is not standardized. When we talked about BP 130, 80 or 140, 90, even today it is with relevance to the mercury sphygmomanometer. In future it may change. When we say that is taken as this one. So better you compare these two, and then if it is okay, then you can ask the patient take BP in his machine. Otherwise, it is see sometimes it is you can take it in the wrist or in the arm. All these things are there, but the instrument has to be counter check with this sphygmomanometer. Now, the office measurement, that is when we go to a doctor, the BP may be a little more, white coat hypertension. That is why marginal cases, you are not expected, doctor is not expected, this is for doctor's illiteracy, that they are not expected to put on drugs immediately. So when the patient comes, little BP is there, and he goes out, he started having headache. That is headache symptoms come after seeing the doctor, after he is telling that he has got a BP. So it is necessary, marginal cases, BP is checked many times, actually 1 month, 2 months, then only you say you have got BP. Marginal cases. If it is 200, immediately you start treatment. In Australia, 4,000 people of marginal cases are checked for BP over a year. After a year, nearly 50% of these cases became normal by only checking BP. It is only to suggest a margin case, don't jump and try to give drugs. This is for the doctors. So it is only, that is the home measurement is always little less on the office measurement. Now you got what is called the ambulatory measurement. They tie the BP apparatus, whatever you do, your BP is measured. That is, throughout your actions and inactions, the BP measurement is there. That is a average BP, that is a much better ideal way, but it is very costly affair, so nobody does it now. So you can still use mercury sigmometer. You may go to digital if it is of a standard nature. Now, management of patient asks many questions. Sir, my BP, I have a hypertension, is it curable? My BP is normal with the medicine, hence I stop the medicine. This is a common thing for diabetes. My BP became normal, I stop the medicine. So, but you know it is not a curable disease. These are all diseases which are permanent, which has to be maintained by drugs. Why do you want to give drugs then? You give drugs not to cure the disease, to prevent the complications of hypertension. You prevent stroke, prevent eye changes, prevent heart failure, prevent kidney failure. These are all the effects of blood pressure. And to prevent that, you have to treat, not to cure the disease. So if the BP is normal with a particular dose, 1 dose or 2 doses, that is the dose necessary to maintain. That's all the meaning. This is a usual fault both in case of diabetes as well as hypertension. They stop the drug and come to me. Now, next is, sometimes they ask, should I practice yoga, meditation, which cured many people, shall I do that? Yes, agree. Yoga, meditation, and also tranquility of the mind, all are essential. You must try low salt diet, all these are essential. But all these will reduce BP by 5 to 10 millimeter of Hg. If it is more than that, these are not sufficient. Drug has to be used. Then another problem I faced is sometimes whenever a patient came, whom I think some 20, 30 years ago to be, I given him Illiteracy as a gold drug. And he was completely alright with that, he was taking it. Then one of his son-in-law has invited him to Bangalore. He is a doctor, he saw this. This is a old drug and there is no meaning nowadays, it's no good. So he prescribed a new drug. He developed some complications and side effects. Then he came running to me. So then I said, well, is there any trouble with the old drugs? No. Then you continue the old drug. That means to say, a latest and costlier drug does not mean a better drug. Which is suitable for the patient is the one, the best drug. So for that patient, advice will be like that. Now next question, is it possible to prevent? Prevention is not possible. Control is possible with many things. In Ayurveda also they say, and lifestyle modification is necessary in all cases of diabetes and BP. That will only reduce the BP to a certain extent. So what is the Ayurveda says? Achar, that's your conduct. Vichar, your thinking. Vyavahar, interpersonal relationship. Ahar, food. And then yoga, abhyasa will reduce the BP to a certain extent. But don't expect a 200 and 120 people to have this only. No, do this plus medicine is necessary. And of course, this is a healthy living diet. You can see the pyramid. So this is the least thing you are eating. Fruits, vegetables, etc. Low salt things you are having. This is the hypertension. Main thing is low fat, low salt diet. Now we pass on to another disease, diabetes. Here also so many questions are asked by my patients. These are questions asked by patients. To understand diabetes, when you eat food, you see blood glucose increases. When it increases, this is pancreas, insulin from here is secreted. And insulin reduces the blood glucose and also his blood becomes normal. So when you eat either sweet, rice, wheat, the blood glucose will increase and then the insulin gets secreted and it becomes normal. This is a normal thing which occurs. But when insulin secretion is reduced due to diseases of the pancreas, then you get diabetes. Or when the insulin action is resisted by many forces, then also you get diabetes. This is the basis of diabetes. Now, common misconception. What do the patients say? I do not have, diabetes means polyuria, excess of urine, polydipsia, excess of thirst, polyphagia, excess of eating, and loss of weight. This is diabetes, classical description. So patients say, but medical science is a varying science. It is not a science in that sense. It will never have the same thing with the same patient at the same time. Now what happens is, patient says, I do not have excessive urine nor I have increased thirst, and yet I have diabetes. Yes. You could be asymptomatic, like BP, you could be asymptomatic, for 50% of the patient could be asymptomatic. Chance finding of diabetes, we say. While checking blood for insurance or something, you find sugar. So this need not be there. Sir, I have checked my blood and last month only it was normal. How is it today? Yes, you can get. If it is 1 week ago, now also you can get diabetes. It is possible. Sir, nobody has it in family. Family history is there in 50 to 60% of the patients. But another 50%, 60% do not have a family history. It is not necessary. Sir, I do not eat sweets. How did I get diabetes? This is next question they ask. Sir, you can eat a mound of jaggery or jalebi. You do not get diabetes. But once you know diabetes, you can't eat any other. This is the thing. So, by eating sweets, you don't get diabetes. After getting diabetes, don't eat. That is all you have to do. So, sir, I am very slim. How did I get? That is known as a thin diabetes. It is common in India. Thin diabetes. He is not obese. So, these are all conceptions patient has got. So, these are questions which patient asks me and I am trying to answer. In public now. Sir, then checking blood sugar. They say, I wanted to see you, that's why I didn't take medicine today. Then what am I checking? If I am checking a particular drug, I have to take the drug and check the blood sugar, then I say whether the drug is alright or not. Many times, on the day of checking, they do not take the blood, tablets. So, I check my blood without taking it, then sugar will be there. So they think, the tablet has cured the disease. So it is not so. Then my blood sugar is normal, hence I stopped treatment, like blood pressure. So I stopped, now everything is normal. You check, then you will see 300 milligrams. So that is what it is. So another person usually, I think when I was addressing a Rotary Club on diabetes, one chap asked, sir, I take sweet, but I take one more tablet that day. I made this joke earlier. But I said, you have a negotiation with the cook. Ask him to put that tablet in the sweet and give you. So, take one more. Is it all right? So, if you are having a feast and have one or two tablets, no, that is not the answer. So, then, yoga, herbal, bitter gourd, acupuncture, cure by diabetes. It will never cure. All these lifestyle changes will definitely reduce your blood sugar. If you reduce your weight, if you don't eat sweets, etc., you all improve your diabetes state to a certain extent. But if it is very high, it is not possible. You have to use the drug. Then this diet sheet business. Now diet sheet is given by all diabetologists. But many a time you see diet sheet is only, actually I had a very bad many years ago that I went to one diabetic patient's house, a friend of mine. Then I saw he gave some chocho or something, and the paper was diet sheet. You see, paper underlying was diet sheet. So diet sheet sometimes are only meant to be hanged. but it will not take a toll. So diet sheet is better. You ask them to write down what they eat and try to write, cancel or add in the sheet. That would be better. There is no point asking Ragi Mudde, North Carnatic people, Kini and Teodo. There is no need. Or you ask Jola for these people. It is no good. So what they eat, you adjust. That is what you have to do. Then, can I take rice and bread? Yes, you can take rice. But of course, pounded rice is better. There is brownish rice. It's much better than this one. The whole idea is that this gets absorbed slowly. That's all. Everything you eat converted to sugar. There is no doubt about it. Even if you eat bitter things, it becomes sweet only, glucose only in the blood level. But whether it goes slowly, whether how much it gets this one, whether rapid rise in sugar, those are the things you see. So rice can be taken. People say, I don't take rice, I don't get for diabetes. No. Rice you can take, but quantity is the important. If you eat 12 chapatis, it's also bad. So quantity of food is more important if you have to. Then I told you about jaggery. Sir, this is an advice given by most of the housewives that are sick. So I add jaggery to cooking. That is better than sugar, isn't it, sir? It's a usual question. Both are sweet. What about fruits and vegetables? You can take vegetables, no limit. And the greens, sopo, no limit. And fruits, you can take half the fruits or so something, no problem. And except mangoes, which people like very much. And jackfruit, this probably contain a lot of weight, sapota, that I think you can cut off. Other fruits you can take at least half. Apple a day, half apple a day. Apple a day keeps it not away, you know that. So half apple can I take diabetic sweet? Now you got diabetic jangir, diabetic ice cream, all those things like that. But the quantity is important. Artificial sweetness you can have it, but the quantity. What is the use of taking 20 jangirs? Diabetic jangir is that. Other than I have to taste it and see. It is good. But you can't take 20 10 or you have to limit the quantity. That's all the thing. Because I don't discuss the diet too much anyway. This will not. Now, what is the guidelines? Only guidelines will talk. You know, guidelines means diet and marriage. I always say this. Advice is given but not taken. Always. This is always the case. And now, regular and frequent meals. Diabetic people have to eat 5 times. Morning breakfast, mid-morning something. Breakfast can be, 1/4 of it can be taken, or some biscuits and that, because sometimes they go into hypoglycemia before lunch. So lunch and mid-evening and night, dinner. So this sort of frequent meals are very important. Quantity will not be increased. That is important. Encourage high fiber starchy food foods with low glycemic. That is high fiber, vegetables, soap, greens, all those things have to be encouraged. Cut down on fat because most of these people have high cholesterol, that you have to. And sugary products, of course. And weight reduction with calorie control. So weight reduction is a must. That is a must for us. This is the diabetic diet guidelines. You can see a lot of vegetables, etc. And sweets are the least you can take. Food pyramid is called as food pyramid. Same thing. Yeah. Now, let me go to another one. Infections. What are the questions asked by my patients? You know, tuberculosis is one of the commonest infections in this country. 14 million people every year will get tuberculosis. We talk a lot about dengue. You do not know one for every minute one death is there due to tuberculosis. For every minute. So tuberculosis is such a common disease. Now what are the things people ask? When I say tuberculosis, people get frightened. When they say asthma, they are not frightened. Asthma is not curable. Tuberculosis is a curable disease. So I have to tell them, don't get worried. Tuberculosis, they get worried. Sir, marriage can be postponed. Yes, you can postpone it, but still it's cured. Don't worry about that. So, is it curable? That's the first question. It's a curable disease. Unless abuse of this drug or inadequate treatment can produce a resistant tuberculosis, and it becomes difficult, otherwise curable. Can I get treated? Older days, they used to treat in sanatoriums. Now all those sanatorium has become mental hospital because you have got more mental patients than TB patients. So tuberculosis sanatorium is not necessary. Sanatorium line of treatment now. You can go to work and all that. Can I get treated at home? Yes. My fever cough substance, I stopped the medicine. This is the usual thing. 2 months everything will be subsided and he stops the medicine. Minimum is 6 months you have to take treatment. Even when the X-ray is better, even when the symptoms are much better, still you have to take. And this is the mistake patients do. After 1 or 2 months they stop. And again to start, he can be resistant to these drugs. That's why you got large number of resistant tuberculosis nowadays. Now, this is a present problem. There are a number of cases of fever with short duration. Most of them are viral. And first question, sir, antibiotic can you give? I say no, because it is an abuse of antibiotic. 2, 3, 4 days fever, unless you find something specific like malaria, etc., you have got anti-malarials. Otherwise, if you don't know any other thing, it's a viral disease. Viral disease does not need antibiotic. Antibiotic, what you need is a crocin or double 650 to reduce the fever. And there is a specific treatment for malaria and typhoid. If it is proved, then it is worth taking. Now, this is the most abused disease at present. Now, you must know dengue is nothing, something special. It is a viral disease. There are 4 types of virus, and it does not need hospitalization except when there is a complication. There is no need for that. No, what all you need is paracetamol, that is crocin, tramadol. These are for the pain and reduce fever and body ache. There is fever, body ache, etc. You give for fever and body ache, look for 4-5 days, it will subside itself. By the time you do, blood comes. So platelet is come down. So patient comes to you now, they would have heard about platelet. Sir, platelet is low, platelet is low, platelet is low. Or you see 60,000, the platelets usually about 2 to 3 lakhs will be there. And due to this fever, it may come to 60,000, 70,000. And so much for you and our doctors are frightened. They try to give a platelet. So much in Bangalore, there are no platelets some years ago. So, it is unnecessary thing. There is no need to give platelet. And even WHO says no need to give unless there are bleeding. So that can come below 10,000. So, you find platelets, that's why the other day minister was talking about that platelet centers is going to open. I was talking to my colleagues, instead of platelet centers, you have to open mosquito killing centers. So if you kill mosquitoes, malaria, dengue, all this will disappear. So it is necessary to say you have a better drainage and mosquito killing organization that is better than platelet centers. Now, there is no specific drug for this, you remember. For the dengue, there is no drug available. And hospitalization is able to maintain when is vomiting, etc., then probably you have to hospitalize. Otherwise, and the platelet, you only below 10,000, you are able to probably, you have to give blood transfer, platelet transfusion, and otherwise you become dengue panic syndrome. You become so much afraid. No, everybody is so much afraid. Dengue means so much afraid. To test the dengue, if it is a poor patient or even doesn't have much money, I would say this could be dengue, but it's a viral disease. If you try to test it, it's 1,000 rupees. If you try to treat it, it is only 10-15 rupees. You choose between the two. Even after knowing it is positive, treatment is same. So many times I avoid taking that. Anyway, unless you want to do a sort of a survey and otherwise, I think better you don't because it costs you 1,000 rupees. Now, next is something about antibiotics. Some questions are asked. Sir, I have got cold and fever. On my own, I started ampicillin. Many a time across the table or across the counter, they supply ampicillin. And patient asks for ampicillin and he starts the antibiotic. This cold and fever, it is also a viral disease. It does not need any antibiotic. It is always told is often to most of you knowing. A treated cold lasts for 1 week, untreated cold lasts for 7 days. So there is no point, you understand, giving antibiotics, etc. It is an abuse of antibiotics. So because it is ineffective and that it can develop resistance and unnecessary expense for the treatment. So patients feel if you are prescribing, it costs less. You may say you may not be a good doctor, you may not be specialized. So they always feel a costly doctor is better than a cheap doctor. Anyway, sir, please prescribe the latest strong antibiotic, whatever may be the cost. There is some people who got money first. So I tell them, whatever the antibiotic, it does not make any difference. So if you have more money, I will add in my fees rather than putting on the antibiotic, because taking antibiotic will produce resistance to antibiotic. Now we have reached a stage, the highest antibiotic is so much used, and now we do not have another antibiotic. That's what a Delhi bugs, you might have heard. Delhi bug, meropenem. That is a drug resistant organism are found. I do not have another antibiotic today. It may take another 5-10 years. Then we have problems. So many deaths will occur. So abuse of antibiotic is a very serious matter you have to consider. Now, next, investigation illiteracy. Now we go on asking investigation without knowing the benefit or without. 2 questions has to be asked. Does it help your diagnosis? Does it help your treatment? If this cannot be answered, better withhold. That's why I say you have to rationalize your investigation. This is for the doctor especially. Sometimes patients nowadays ask the investigation. Rationalize, then you can ration your investigation. Now you see, I have got cold and fever for 3 days. My doctor says I have typhoid. Because there was one test known as Vidal positive. Vidal could be positive because he had typhoid earlier. And 2 to 3 days it won't become positive. So that test is useless. If you are doing your second or third day, it's a useless test. Then what you have fever is something else. So it's a useless test. Same thing, your patient has cold and cough. Somebody does a Montauk test here, tuberculosis, but it's positive. People who have BCG will have positive. And then, should I treat suffering from TB? No. So these are things if you are not able to interpret properly, without taking history or examination of the patient, you go to unnecessary investigation, unnecessary expense, and the cost of health maintenance increases. And then I told you, my son's platelet count is 70,000. Doctor wants to give platelet. What shall I do? Nothing. You do nothing. Go on checking platelet every day. Today, if the fever is normal, tomorrow it becomes 1 lakh. I always say, if it is 70,000 today if there is no fever, tomorrow it becomes 1 lakh here. That's what it is. That's conclusion. Yes, lab tests may be misleading without the support of history and examination. Because patients ask these questions many a time. Now, this is another thing. CT and MRI. So this, no doubt, after the Ranjan who found out X-ray, is the next important investigation. They had no way to know how does brain look. What all we are trying to say in a brain disease, put an inject here, vessel whether diverts, put air here, without seeing the brain. This CT scan is the best investigation in the 1970s by a physicist and a medical man, and this will tell you how a brain looks. So when a patient comes to me with a CT scan, I always say, your brain, it only shows your brain. Now, what happens? I have got cases, fever and headache. Sir, patients themselves are, I have got headache, you would have got a causes of headache printout anyway. Sir, I have got a CT scan. Or you insist the doctor, you must have a CT scan. Doctor is afraid, he will do it. Sometimes doctor himself will ask for a CT scan for various reasons. There are low monetary consideration, etc. So he will ask for a CT scan. So that this patient, he has a fever of 2 weeks, he has headache, and he has a CT scan. He comes to the corporate hospital, And then he comes to me because fever did not subside with the CT scan. Before I take a history, it is not history and examination give you 85% of your diagnosis. Before I talk to him, sir, CT scan, CT scan. I told him, CT scan will tell you have got a brain. Let us see what is this. So what has happened was, he had a typhoid. His fever is the cause for headache. Everybody has got headache. So where do you want a CT scan for it? So when you treat the typhoid, all this disappears. So unnecessary use of CT scan. It's a very useful investigation. It is the first time you are able to show the brain. You can suspect a stroke, you can suspect a tumor. That is the one which gives you. I am not discouraging that. But be wise to use when it is necessary. For example, second case, he has got jaundice, confusion. This is due to liver disease, he gets a brain confusion, etc. If you do a CT, nothing you will see. It's an unnecessary thing. So somebody has whole body scan. You must know for what sake you are doing. Otherwise, unnecessarily, you are doing this investigation. So, when it is necessary, you do it. And because so many times patient asks this to me, sir, shall I have a CT scan? And if you have money, you can have it, but it's unnecessary for me. So, in conclusion of the investigation, lab test may be misleading without the subsequent history. And I told you, other day there was an abdominal pain patient, telemedicine nowadays. You are on telephone, you talk to a doctor, sir, I got an abdominal pain like this and all that. He said, you take some antacids and all that, he took. And after 3 days, he is a Pandit from Kashmir, so he did not get, he is my old patient. Then he came down to me. I said, all right, you will lift up your shirt. What I see, herpes. Herpes is, sarcomuno. Herpes is the cause of pain, not the acidity. So, physical examination is important first. When you do that first, you limit your investigation. What is necessary, you will ask. Lab test will be misleading without the support of history and examination. Appropriate use of investigation is necessary. Appropriate, when you want it, you ask. And these two questions are, does it change your diagnosis? Does it improve your treatment? Then it is inappropriate. When you ask for a test, then it is unnecessary, unsuccessful, unsafe, unkind, sometimes unwise. Now, problems with health, generally conclusions. Problems are, if we do not have enough knowledge, both the doctor and the patients, what are the things you can have? Your misconception may lead to wrong management, disease may get prolonged, get complicated. And you must also know, patient has to know there is a limit to the medicine. This is a very important thing. I will quote a French physician. He is somewhere in 1870. He quoted, what is the doctor's duty? To cure sometimes, and to relieve often, and to comfort always. To cure sometimes with typhoid, pneumonia, etc., you can cure them. Relieve, that is the blood pressure, diabetes, etc., you can relieve them. And if possible, comfort always. So if you take that, then this limits to medicine you have to know. You must know what doctor can do, or he cannot cure. So, if we know this, assault on doctors and institutions is reduced. Misunderstanding goes on. Frequent change of doctors do not go. Oh, fever has not come, so he goes to the next doctor, go to the next doctor. So that the first doctor, if he is a young man who started his practice, he wants to see maximum the drugs are given. Because otherwise he will miss the test. So, frequent change of doctors and then increasing number of investigation. So we must know, patient should know, his literacy regarding this should increase when he knows this. And internal knowledge about the disease may not be relevant for a particular patient, as a wisdom is necessary. To conclude, I will quote, information when understood correctly is knowledge. That is, when you see internet information, you understand that, then you are knowledge. You are knowledgeable, yes. But knowledge when used properly is wisdom. So I tell my patient, you have a better knowledge than me, but I have the wisdom. Thank you.